15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cells super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about 1 foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
So just to recap, so my wife was ill, same day. Okay. We had to go to see this, and he starts asking her questions, and he did help her, and in the long term. And one of the questions he says is, stress can cause all sorts of problems. Is there any stress in your life you can get rid of? She starts pointing at me, okay, because I've been self-employed now for 40 years, and most of my life there's these ups and downs, and I can say I've been experiencing a lot of valleys in design. You design something wonderful, you get it all working, and all of a sudden the company doesn't have the cash to finalize it or get the patent or whatever, so it comes to a grinding halt after all the work that you poured in with everything hoping to happen. Anyway, so with her, he says stress, and she's pointing me. He says, so what do you do? And I said, well, I make this dental device. So it's for hardening the white films, and it was a device about that long. I sold it to dentists, and it was the first one out there, besides 3M, that had a high-power blue LED in it. I mean, it would harden the filling much deeper, and that was key in dentistry, is to harden the filling all the way down, not leave anything not hardened, so you don't leave any resin or catalyst remaining unhardened. So I could fully understand that light could activate a compound or a chemistry chain to occur hardening of the filling. And he said to me, he says, can you make it red? And I'm like, why red? And he says, well, red is the right wavelength to photoactivate a drug that kills cancer. And my interest was piqued at that point because, hey, everybody's heard the line, the cure for cancer is just around the corner. Well, here I am talking to a doctor saying that light can photoactivate a drug and kill cancer. So as it was, within, the interesting thing was that he was going to go out and buy 10 red laser pointers and put them together with elastic bands and use it for an illumination source to activate the drug. And he had 2 patients lined up. And the drug was already approved in Canada for many years earlier for bladder cancer. And the neat part about it is when you shine red light at this compound, the 5-ALA, it's actually not the compound, but the compound is a precursor. So the precursor 5-ALA ends up transitioning into porphyrins. Everybody makes porphyrins in their body, or everybody would be dead in this room. So everybody requires porphyrins. What happens is when you take a higher amount of it orally, it gets collected by the cancer cells, and the cancer cells just feed on that and create a high amount of porphyrins in the cancer cells. And then when you shine red light on it, it shakes up the molecule, breaks it apart, and it releases an O1 right inside the cancer cell. Imagine that if you could selectively pour hydrogen peroxide into each one of the cancer cells. Well, this is what's happening with this. And what's really nice, it's really nice and selective, and it kills the cancer cells selectively. If you want to ask me more about it, but we've tried for 15 years to move that forward. It's unbelievable how much lack of interest in something that could be economical to treat. But when it came to the PBM, at that point, I still wouldn't have believed PBM could do anything red light. And, so what happened is I had to do a tweak on the device, this cancer light. Within 3 weeks, we made the first high-power, liquid-cooled LED device for delivering a very high amount of light energy. And with that, we were able to activate this drug, and we shrunk the cancers within 1 month on both patients with cancer on the throat and breast cancer. And anyway, so I had this device back in my hands, and I put it on my, I thought, I had a back injury from 20 years earlier. I fell off a ladder, second floor height, and fell onto concrete. Bad flying lessons for the day, but I hurt myself, didn't break anything. But every year, 2 years, I go and pick up a paper clip, and all of a sudden, and you just feel that just shooting pain. And then I'd be 4 months, 3 months, 5 months recovery with severe pain in my back with muscle spasms. And I thought, I got this high power light, I wonder if it will do anything. So I put the light behind my back. I sat down in my chair, and this is going back like 16 years ago, and I sat down, and I was working on my computer, doing something, and 20 minutes later, I'm like, that's weird, I can move. And I got out of my chair, and it's like, I can even bend over. In 20 minutes, I reduced the muscle spasm, probably from a pain of 8, like it was just searing, where it's hard to concentrate, down to like a 3, where it's just there, like it, but hey, deal with it. So that's my introduction to PBM. As soon as I learned that, I developed a bunch of LED devices. Now I'm going to fly through some of these slides because I'm giving you a little prep here. We've got 2 other excellent people, 3 excellent people coming up. We've got Dr. Margaret Naser here in the front row. She's going to be talking about a case study with concussions using one of our light devices and the helmet. And also we've got Dr. Jenny Flora and Kelly Huffer, Dr. Kelly Huffer from West Virginia. We just finished with a study with light therapy going into the brain for opiate addiction and depression. It's been published. It's on Ann Liebert's journal, and we will have copies to give out, and it's free right now to download. So let me go very quickly through these slides. Sorry if I'm racing because I talk too much. Okay, so interesting thing is laser versus LEDs. Many people, now first of all, how many in this room have a real strong understanding of PBM? Okay, about maybe half? Okay, how many are actually utilizing PBM on a daily basis? Oh, quite a number of people. Thank you. Thank you very much for those that have seen it work. Isn't it amazing? So we'll just go back to lasers. So laser is a coherent light source. So you see how the dot goes up to your finger. So if I shine the light across the room, it'll be a dot on the other side of the room. I believe there's a misunderstanding, and I'll let the data show what I've seen, is that between lasers and LEDs, if you start off with the same optical power of laser or the same optical power of LED, when you go through a significant depth of tissue, I'm starting to really exaggerate, but when you're trying to treat inside the hip, down to the hip joint, which still is pretty significant depth, the amount of power getting there, depending whether you got laser or LED, doesn't matter. And so what I found, I just show you here, if I shine that laser, it's a dot. Everybody thinks of it going through all this tissue remaining as a dot. No, it doesn't. It immediately diffuses, as you can see on my picture on the finger. It diffuses because the light scatters through the tissue. If you take an LED and you put it on there, and you put your finger, you can see how wide so it's LED beams out, and there's a wide divergence on LEDs. If I put my finger on it, those two are exactly the same power. And I've actually taken power meters. I've got all sorts of fancy electronic equipment, power meters, frequency measurements. I've got every piece of equipment because 40 years of being in the facility. Oops, something's wrong, and I don't want to lose my power. Just like this laptop, I need a lot of power. I do not have battery-operated devices for the sheer reason the amount of power that we use. We need on the back of this thing, we need a very large battery pack on the back, like one of these big drill packs. So it's not useful. It's too heavy. So we just run it off the AC power, and you can run it 24/7 and turn it on to, well, great, just do that. There you go. So I don't know if you can see that back there, but you can see the light going right through my hand. Many of you, if you've done it as a kid on a campfire, you saw the light going through your hand. The interesting thing is I've got pictures, not on this slide, but this is right now 1050 nanometer. It's totally invisible to what you're seeing right now. But if I take a Android cell phone, there it is. If I take an Android cell phone, Android has a poor camera in it, and we will show you it has a poor camera. So what it means is it doesn't have a good IR filter, near-infrared filter. And you can see the light come. Anybody can do it in the room here, but you can see those dots there, the purplish dots, but you can't see it this way. This is, for some of you that are, if you got dentist background, you would think, oh, I gotta have where's the laser glasses that I gotta wear? Well, because an LED is diffused, it works very well because it becomes a very uniform, even amount of light. So there's no hot spots that reach the back of the eye, especially if you're back a little ways. There's no hot spots on the retina. Okay, so it's very safe. As a matter of fact, we've had some people with, okay, it went to sleep on me. Do that. There we go. Okay, talked a little bit about that. So what we did is we did a study with to test how much power comes through a stack of tissue. Now, if you can imagine one steak thick, let's say 3/4 of an inch. If you want that in centimeters, that's about about a centimeter, just over a centimeter. No, 2 centimeters and a half thick of steak. We also did it with 3/4 of an inch, 1.5 inches, and 2 1/4 inches. So we're talking quite a span of tissue. And what's very, very important is how do you measure it? Because if you're going to start off with a laser and you have an LED, you want to make sure you're fair to the measurement of the light. You want to know that you're accurate with the light measurement. So what I did is I set up a special system, which I'll show you in just a minute. So the procedure was the SunPower devices were compared with lasers at the visible red, 660 nanometer, and 2 near-infrared wavelengths, 810, 1050, or 1064 was laser. And then we did 3 different types of meat: chicken, pork, beef. You're going to ask, why did we choose those? It's because we could buy them at the supermarket and we could eat them after our study. No, not really. So we used the spherical culminator, which I'll show you in another slide. We also took a laser of 660, 810, which was a K's laser. They were 200 milliwatts and 500 milliwatts. And to be fair with doing side-by-side power studies, not unit studies, I just want to know if you start off with 5 watts of laser, compare it with 5 watts of laser. If you want to, what's the comparison between the two? Next slide here is this is a spherical culminator that came from Mars. No, it's a beautiful machine. what this is a ball about this big. It looks like an exercise ball, and it's all reflective on the inside. It's more like a white paint on the inside. And what that does is there's an opening, and there's ports here, you can see the ports, but there's only one opening on the top. We limited the opening to a 2-inch diameter size. What this does for us is on the other picture over there, we can put a sensor anywhere in that ball and it'll pick up accurately what light levels is coming in. So you can actually get a relative measurement of the power that's going through that state, through that port, through the chicken. So what we did is we had a 2-inch opening on the top of that, and I show you on the top example, I show you either we're using our LED cluster, as people call it, or a laser. Okay, there's the two. So the light comes in the top. Light can't get anywhere else in there, so it doesn't. You don't even have to have a dark room. There's no way light gets into this thing. So you can measure it very, very accurately. It's calibrated for each one of the wavelengths. So when you do some automatic calibration, so you know exactly what you're doing and what you're measuring. Too many people out there are using light meters just off the shelf from Amazon, haven't got a clue what they're doing with it. You have to know what the correction factor is for the wavelength that you're using to measure accurately. So the interesting part about this culminator is if I had a culminated beam, just a sharp beam shooting right in, wouldn't matter where I pointed that beam, anywhere in the ball, it'll measure it accurately as long as I go through that 2-inch opening window on the top. So it doesn't matter whether it's a sharp beam, culminated beam from a laser, or it's a large LED cluster. Okay, so next bit, there's the laser shining through a piece of chicken, and here is an arc laser shining through a piece of pork. It was very cool. Now, as I said, it diffuses the light, so I'll have to get into this separately with you guys when we got more time. But on the left, as I put the unit right against there, as you can well enough imagine, this is running off a battery source, so I can make it easy for me. Okay, if I brought that away from the device, you're covering a bigger amount of area, so less is going to get there. So you have to have this against the skin tissue. You're not going to have it out here. If I took the same laser and I put the laser right on the surface, or I pulled the laser way back here, as long as I pointed the laser within that, on top of the meat, within about that 2-inch diameter, it gave me the same measurement through. So you could treat somebody from across the room. I don't know where the benefit of that would be, but if you had a diffuser on the top, you could actually diffuse the beam, but then you'd have to stay right on top. See, the laser has a diffuser on it, so it actually is the light. You can actually see how much diffusion is there coming out through the side of the tissue. And I know very quickly, I got it. Okay, so we have different LED products here. Okay, okay, is this, it's on the next slide. Okay, this would be very unfair if I did it this way. If you look at the left-hand side and the right-hand side, there's an order of magnitude difference between the two. And that's because the laser that I was using at 660 only had 200 milliwatts. So what I did is, to be fair with lasers, I multiplied it by 25 times so that I would come up to the 5-watt level of our light device. Okay? So as you can see here, that's the difference. It would be 0.44 to 0.02 as a measurement comparison. Not fair. So we did a 25 times increase on the power here. And when we did, this is the graph we got. What's really cool about this is the two follow so nicely as far as the penetration. Yeah, there's a little less in the laser. Pretty much when you do the correction factor, the two plot really nicely side by side on chicken. Okay. Okay, I gotta go down. I gotta get used to this. Actually, I wonder if this works. We'll try it. Hey. Okay, so how nice is this? This is at a 10 nanometer over there. Look how nice they plot. Now that's again normalizing the laser from a half-watt laser, multiplying it by 10 times. So you got a 5-watt laser compared to a 5-watt LED. Look at the curve that's there. It tracks really nicely. We got one anomaly that you can see over here. I wonder if this, yeah, good, okay, here's the laser. Okay, so we're not sure exactly what's going on here, what went wrong, but that's the way it plotted, okay? Otherwise, I would have expected with our 10 times multiplier that line right there would be up to there. So we would plot just like this starting point, right? Okay, look at how little difference. This is at 1050 nanometer. Now, I'm just saying generally, okay, between the two. So we didn't have to use a correction factor on here. Again, that's that point that we had in the front end. We're trying to figure out what's going on, what happened there. But if you look at 3/4 of an inch here, this is 1.5 inches of tissue, 2.5 inches. Okay, the LED 1050 is a little lower. The laser is performing a little bit better, but so very, very close between the two. Now, there is one big difference about lasers and LEDs, is a little bit more, maybe a little bit more power at the 1050, but one costs, my device costs around $1,900, and the laser costs between $20,000 and $30,000. This, if you took a laser and shot it across the room, you could damage somebody's eyes. You could be really safe with this device. Okay, and okay, there's the graphs of the chicken. I've got all this data. We have a, and here's the same thing, how when you normalize it, give the benefit, increase the numbers, you can see how closely they track. Okay, this is with, this is with the state. A lot of reduction in the energy levels, as you can see. Okay, so yeah, I just don't have time to read all that, but it's in my report. So the SunPowerLED started as Kerber Applied Research. I also have Kerber USA. I have a few other companies as well. But Kerber Applied Research is the flagship of where I've done the research for 40 years on all sorts of electronic devices. We have LED devices, the big laser operating room lights that I've developed for another company out there. I've got all sorts of different kinds of electronic devices. Okay, let's see here. I'd like to acknowledge Ezra, Paul, and Dr. Robert Zadowski, who's been helping me. Okay, and there's, and the QR code. Please go to this, and that'll take you right to our page where we're going to post everything, but we're also going to be on Twitter as well. Okay, so please have a look at Twitter at SunPowerLED, and we'll be trying to post today's events. So even if you miss a meeting, we're hoping to catch it somewhere. Okay? And okay, I don't have time, but the safety is there. I've done power levels, that's all. We got to go. Okay, but just a real quick. This is, for those that haven't, how many in the room have not experienced PBM firsthand or have seen PBM work? Look at that. Great group, everybody understands this already. This is my granddaughter. Again, we'll have all this stuff posted. She had second and third degree burns. She had moved boiling water towards herself, and it flipped, pouring the boiling water down her leg. And look at how fast the tissue is healing. By day 6, it's totally nicely come up, and by day 8, there's it's all healed over. And with 2 years later, there's no scars, and you can tell it's a kid. See that ink on there? Okay, this is another picture. There's another, I just showed that quickly. Here's 5 weeks post. That's by another fellow that did light therapy. This is an interesting case here. The guy swung a pickaxe around and right above his ankle cut it through. And they told him 6 to 9 months before he's going to be walking, and immediately started PBM. As soon as he did, there was no more pain. The inflammation reduction was huge. 3 weeks, and, oh, I'm missing it. I've got the videos, but he's walking at 4 weeks. Oh, that's diabetic foot ulcer. That they were going to amputate that foot within a week. They stuck the light device into the hospital, used it undercover, and they canceled the surgery, and she saved her foot. Other beautiful things. I even had to experience it myself. I knocked out my front tooth. I fell forward right into concrete, did a face plant, bounced off the concrete. Not a good thing to do, but very quick. And there's other things. So, anyways, that's there's so much here. I can't go there. So, and I see we got. So we're going to bring on. There we go. Okay. It's down the. Yeah, I do have an oral device that snaps in the front. Okay, there we go. Margaret?
Can I have your laser? I need a laser.
Oh, wonderful. Yeah, here you go. You can even sit down there. I think we got it.
Oh, I got that.
Okay. Can you do?
Might be faster.
Okay. All right. You want to go in front? Oh, there. Perfect. Tom? Hey, this is.
Like a microphone.
Yeah.
A laser pointer?
No laser, just microphone. Unless you want to use this microphone. Okay. Do you want it in this button right here? See? There you go.
Oh, okay.
See that button right there? One
Okay,
up.
the black one.
Yeah, the black one you can't see. There you go.
Right, okay.
Okay, very good. Okay.
Very good.
And I'll advance the slides for you?
Yeah, that would be really good.
Okay, I'll stick around here. There we go. You want to fill this mic then?
I don't know. Well, I guess maybe I should use that.
Okay.
I have to be able to see what I'm looking at.
Okay, that's good.
This way.
That's
And
perfect.
you'll advance the slides, isn't it?
Yes, okay, so go ahead.
Right, so I do work, I have an academic.
No, keep it up close to you. It's better that they
It
turn it
sounded,
down.
I get an echo
No,
here.
that's fine. Don't.
Oh, all right. So I go to Boston University School of Medicine and the VA hospital in Boston. And the research topic is transcranial photobiomodulation, mostly with TBI and PTSD.
Okay.
So, we're going to talk about a 12-year-old boy today. And they did
Excuse
make...
me 1 second. I'll just say, so we got a helmet. That helmet on the left-hand side is 10 of these guys. They're all positioned correctly with air circulation for cooling and everything. So that's how we were able to get these 10 locations continuous.
Great. Okay, fine. And this is the front of the head right up here. And so there's going to be 3 on the left side of the head, 3 on the right side of the head, and then 4 down the middle. So now, you will get a handout for my talk because there's a lot of information in here. But the printer broke, they said. So I'm not sure when.
So please visit our booth downstairs, I don't know, downstairs. Yeah, SunPowerLED, and we'll have the handouts for everybody.
It's just 1 page, and all the information, well, it's 1 page, but all the basic information of the protocols on there. So we have this 12-year-old boy, and he fell very hard on the concrete floor in his church, and he lost consciousness for a few minutes, and he has no memory for the event, even to today, even though he's quite fine today. They did a head CT scan in the emergency department at McMaster University, and they showed no intracranial hemorrhage, because you'll never want to do transcranial photobiomodulation in an acute TBI case where you've got active bleeding, because you're going to vasodilate the blood vessels, and then you're going to have more bleeding, so we don't want to do that. But they did, as they always do with acute traumatic brain injury, go right to the ER. The ER will immediately take him to CT because you're going to see a lot of blood very quickly, easily on a CT scan, and it's a lot less expensive than MRI. So that's what they did. And but in the meantime, let's see, I have to push the right invisible button. Okay. So we know there's no bleeding. Now they told him to go home. This is typical for acute TBI. By the way, 75% of traumatic brain injury, whether it's car accidents or skateboarding, whatever, is closed head traumatic brain injury. There's no fracture of the skull. There's nothing to see. You always come out basically looking like a normal brain. And but you can do fancy, very expensive MRI scans, and you can start to see changes and metabolic changes also. But, you know, this is typical for, you know, very good care for what they have, and they don't have photobiomodulation, unfortunately, in the emergency room. But anyway, so they send him home, typical, and then just follow up with a neurologist in 2 weeks. Okay, fine. So he has confusion for the event, keeps asking the same question over and over, 5 days of this. Why does my head hurt? And the family explains, but he doesn't remember. 5 minutes later, he asks the same question. And he had severe headache, nausea, vomiting, couldn't focus, couldn't read, and that went on for 5 days at home. His mother, I don't know how she knew Tom Kerber, but she said, okay, here we go, we're going to see Tom Kerber in Hamilton, and he did the treatment. I'm just doing the more or less backup on MRI imaging and some of the information. So if you want to talk about that, what you did,
Yeah.
I'm going to show it too.
Okay, we better just keep going. I'll show the video now.
No.
Okay,
No, there's only 2 more slides.
Yeah, okay, all right. Go to the next slide.
Yeah, so anyway, I wait though, before you take it away,
Okay.
I want to mention, so he was treated, I'll show you the protocol on the next slide, but it's only a 4-minute treatment. This is going to be a 4-minute treatment, basically with what he showed you.
10 of those.
Yeah, 10 of those, 1 minute with red.
Yep.
Turn that off, follow the near infrared that you can't see, it's 810 nanometers, and it's going to go deeper, a higher number, 810 versus red 660, 660. And that's 3 minutes, so the whole treatment is 4 minutes. And he received one of those treatments, and within a couple of minutes after that, he's 90% better. They were so excited. Tom Kerber calls me in my condo in Boston, and I talked to the mother, I talked to the 12-year-old boy, and they're very articulate. And Tom made a video for when they came back 4 weeks later. 4 days later. But his symptoms improved very quickly, and I want to tell you why.
Okay, next slide.
I'm sorry, I'm trying to push the laser thinking I'm advancing.
There you go. Oh, there you go.
Oh, there we go. Okay, so this is the CT scan, just to orient you. This is a coronal right down like a slice of bread from the top of your head to the base of the head. And it's very important to do that. This is this bone outside the head, the brain. And there is here, lateral to bone, outside the brain area, is a hematoma. And it's the left parietal region. So he hit his left side of his head. And now he's got a bruise outside the skull. And that's where his headache is coming from. He's complaining bitterly about that. But there's no bleeding inside the brain itself. This is just an axial view. It's kind of like a horizontal slice of the brain. And we see the same hematoma, but it's outside. That's so important because we want to know that there's no bleeding inside the brain. Okay, next, thanks. And so, yes, this is what it looks like. You can go to the booth and see it. When the red is on, this is what it looks like. And you can read all these different parameters. So 4 joules in 30 seconds, that's really a really efficient device. And so you did it for a minute, so you delivered 8 joules per cm squared with red light in 1 minute. The next 3 minutes, you're going to use only near infrared, and the wavelength 810, it's going to go deeper. And it was only 3 minutes to do that. Next. Okay, this is basically why it worked. And it's that transcranial photobiomodulation delivered to the whole head. It's going to vasodilate blood vessels. It's also going to vasodilate lymphatic vessels. You see these little tiny white circles here and the red arrows? Those are lymphatic vessels, and they're in the mid-sagittal suture line. And they run down and go, oh my God, here comes the helmet. And they're very vulnerable, and they're very tiny, and they're actually located in the dura mater. Okay, but they run all along, so it's very vulnerable to damage to the lymphatic vessels as well. But they will be vasodilated when you apply red or near infrared light. And so what happened, I think, with this child is that you could easily treat him. He's got young vessels. We're going to vasodilate quite easily. He doesn't have arteriosclerosis in his blood vessels. And so it probably, this is, by the way, is anterior here. This is the frontal lobe up here. And then this is the lymphatic drainage system. with a spray here. So it actually follows this mid-sagittal suture line. And you want to vasodilate those lymphatics as well, because you've got to get all these waste products out of the brain. And when you don't have help to get those waste products out of the brain, the injured brain, this goes on for days and weeks and months. It can go on, they can be very slow to get all these waste products out. And everybody makes that beta amyloid every day, all day long. But then you go to sleep at night and you get rid of that beta amyloid. So anyway, with all kinds of Alzheimer's cases and progressing neurodegenerative disease cases, they tell you, I can't sleep, I can't sleep. Well, that's a problem, because it's at nighttime that the vessels will vasodilate. But we can do it in the daytime with transcranial photobiomodulation. So anyway, I just wanted to bring that up, that we're doing blood vessels and lymphatic vessels. And that's why he got such a good result. And now we're going to play a 3.5-minute video with an interview with the boy. His name is Tyson. His mother says it's okay to say his name. And that's the mother, and they came back 4 days later. And you can take it from there.
Dr. Nasser, thank you so much for presenting this. Isn't this fantastic? Hi, Rose. Tyson, what happened?
Well, I went to like a group, so it's like kind of like learning skills and stuff. And I fell in my head. I got a really bad concussion, so I couldn't really do anything. I couldn't read. If I stood up for too long, I get a really bad headache. And we tried different things like oils and stuff like that. And then my mom's friend recommended this, the red light therapy.
Yeah.
And so we went over here and we tried it, and straight away I felt results after it was done. My headache cleared up like quite a bit, and that day I was able to pick up a book and read, when before I couldn't even read a sentence.
And when did this happen?
Happened I think last week Friday.
Okay, last week.
It was Thursday.
Last week was Thursday.
A week ago Thursday.
Yeah.
And
he had like severe memory loss. He still doesn't remember that day at all.
right?
So I don't know if we'll gain that memory back. But we took him to Mac, and they did a CT scan in that, because he was continuously asking the same questions, like, what happened? Why does my head hurt? And like, it was on a reel, like probably every couple of minutes, we tell him what happened. He's like, oh, that would be why my head hurts. I don't remember going to cats. Yeah. And then he would ask it all over again, like, how come my head hurts? So, like, he probably did hundreds of times. So they did a CT scan, and they didn't see anything on the
That's at McMaster University.
Yeah.
Yeah.
And then he's going to follow up with a neurologist in a few weeks, because it was bad.
Right, did you have any double vision?
No, not that I remember of that day.
But you couldn't read a book, and
No.
you couldn't watch a video?
No.
Okay.
I had to really lie down. If I stood up and tried to move around and get a bad headache. I tried reading a book, I got, I think, a sentence, and then I got a splitting headache again, so.
Okay.
Because he really likes reading, so he was hoping to, because he was bored, he gets bored, because he's lying around in a dark room listening to audiobooks. But yeah, the minute he started reading it.
Okay, and so you did a light treatment under the helmet?
Yeah.
And that was 1 minute of the bright red and 3 minutes.
Of the one you can't see.
Right, that's the near infrared.
Yeah.
And so 1 minute and 3 minutes, so 4 minutes of treatment.
And it was amazing. After the 4 minutes, I could tell straight away my headache was gone. I just overall felt better.
Yeah, so you were still tired, so you
Yeah.
didn't read yesterday yet.
No, I didn't read yesterday.
Oh, you didn't read on the day of the
Yeah.
yesterday, so.
Yeah, I tried it and I'm like, hey, I can easily read. I don't get a headache at all.
Well, we can tell it was because he was really subdued. Like, he's been really, like, just hanging out. He's really quiet and not.
Right.
And now he's like, whoop!
Oh, that is
He's
excellent.
definitely back in that sense.
And we're going to do just one more final treatment here, Carmen. And just to make sure that things are covered. But well, thank you very much for being on the video, Tyson, and really neat how we were able to see this. This is going to tell a lot of people what light therapy can do.
It's very grateful. Yeah, we're very, very blessed and pleased that we found this.
Yeah.
Okay, all the best. Bye for now.
Yeah.
Okay. Yeah, so, this is great how fast he turned around. One day he couldn't read a sentence. The next day he was able to start reading a book, and he's an avid book reader. We had another individual, I'll just say quickly, that he had a concussion, fell down from an 8-foot-high fence, really knocked his head. And the turnaround that he had double vision. He had a patch on one eye because he's seeing such bad double vision. And when he did the light treatment the first time, 2 days later he comes off and he doesn't have the patch anymore. And he says, I can see pretty good. He says, but just that far wall, it's a little fuzzy. He did the 4 minutes of light treatment, came out of the room. I didn't say anything to him. He says, oh, that's clear over there now. that quick. So we've seen strokes, we've seen concussions, we've seen dementia as well. Lewy body dementia, fantastic case. I got a lot of on my SunPowerLED website, I've got a lot of webinars. I've got researchers, doctors, dentists. So please visit there. Please visit our booth and find out more. But now we're going to go to our next Zoom meeting with, I hope everything's going to come up okay. We'll see in a moment. Okay, all right, I will. Okay. Let's see here. Let me turn off this mic just to make sure we don't get any feedback. There's the helmet, that's the red right now. And if you want to flip it to the near infrared, that's 810 nanometer. Doesn't look very impressive, but actually it's the same optical power going down.
We'll get another one.
Yeah.
Got that.
Okay, and Jenny, are you there? Jenny? Okay. Okay, maybe I gotta turn, oh, that's what I gotta do. Jenny, are you there? Can you come on for us? There we go. Hey, we got Jenny, Dr. Jenny Flora, and Dr. Kelly Watson, Huffer. Please carry on from here. I'm sorry we got a little bit time constraint, but I'm sorry. Yes, I got to change my screen. Share. That's what I got to do. Share. And we got to share this one. Thank you. Oops. Let me just minimize this. And we'll get that right away. There we go. No? Okay, good. Stop share. We'll get there. There it is. Stop share. Share. Okay, please. Thank you. Okay, we got to zoom up. There we go.
I want to say one thing while we're taking care of that. We have treated 4 former football players. 2 were NFL and 1 Canadian football league, and they all improved. And they met all NIH criteria for possible CTE. So I wanted to get that information out there too. This is great for these neurodegenerative diseases. They may need ongoing treatments.
And Tom, I want to thank you for fixing this up. This is good. Usually the sound man is the guy who everybody looks at when things go wrong. When everything goes right, then nobody pays attention, right? Anyways, thank you, Tom. Okay, take it away from here, Jenny and Kelly. Go for it. I think we got audio.
All right, thank you, Tom. Can you hear us okay?
Yeah, you're perfect.
Perfect, all right, thank you, thank you. So my name is Dr. Jennifer Flora, and I am honored to be here today at the World PBM Conference. I've always wanted to visit London, so I guess I'm like halfway there, virtually anyway. So I represent the Center of Excellence for Photobiomodulation at Shepherd University, located in Shepherdstown, West Virginia, in the United States of America. This region has been the epicenter of the opioid crisis, which has profoundly affected our communities. West Virginia has been disproportionately impacted by the opioid epidemic with the highest overdose death rates in the United States. This crisis has devastated families and communities across our state, making it one of the most urgent public health issues we face. Given the severity of this crisis in our region, it has become imperative to explore new and innovative treatments that could help alleviate the suffering caused by the opioid addiction. So our study that we're going to share with you today aims to investigate the potential of global transcranial photobiomodulation therapy as a non-invasive intervention to reduce opioid cravings and alleviate depressive symptoms in individuals with opioid use disorder. And the idea was to explore whether global tPBM, when used alongside standard care, which involved MAT, so medication assistant treatments, group therapy, individual therapy, and other support networks could offer additional benefits in treating these complex and interrelated conditions. So we conducted a pilot cohort study using a quasi-experimental design. Participants were recruited from a local outpatient rehab center and were randomly assigned to one of two groups. A treatment group that received tPBM therapy in addition to standard care, and then a control group that received standard care alone. The tPBM therapy was administered using the SunPowerLED Helmet at the 810 nanometer wavelength, and it was chosen for its proven ability, like Tom demonstrated, to penetrate scalp tissue and reach the brain. Each session lasted approximately 3 minutes, and they received 2 sessions per week over the course of 8 weeks. So I'm going to kick it to Dr. Kelly Watson-Huffer, who will discuss our study's findings and the implications of our research and our potential future direction for tPBM therapy in treating opioid use disorder.
Thank you, Jenny. So our results were amazing. We were not expecting what we got. I'll let you know that we had 50 participants in our study initially. 11 of those dropped out for various reasons. So 39 completed the study, 22 in the control group, and 17 in the group that was utilizing the helmet therapy in addition to standard care. What we found at the end of our study time, that the treatment group with the transcranial PBM therapy had significant reductions in the outcome measures that we were looking at, including cravings for opioids, so that's intensity, time, and duration, as well as depressive symptoms. And those results were all statistically significant compared to the non-PBM group, which was our control group, who had no statistical significant changes in cravings, time, frequency. There was a mild reduction in their depression symptom scores at the end of the study. However, those results failed to meet statistical significance despite that reduction. So we were so elated at these results that we actually ran the statistics twice because we thought we made a mistake the first time through, and certainly we did not. So we're super excited about this. So what this shows in the end is that we are supportive of the transcranial PBM therapy to alleviate some of these symptoms of cravings associated with opioid use disorder and depression. And we know depression is a comorbid condition related to opioid use disorder, and so it's important to look at both of those issues. We think that hopefully, as this moves forward, that we can do some randomized controlled trials with a sham device to, get a little more rigor to our study. This was just a pilot study, and we're hoping to do maybe some longitudinal studies eventually over time as well. But I know we're short on time, so I wanted to be very brief and just let you know what we found and how excited we are out here at Shepherd University to continue to work with Tom and PBM to make impacts on our population that is suffering from addiction.
Well, I so much wished you guys could stay with us for another couple minutes, 5 minutes, 10 minutes, but unfortunately we're out of time. We got a couple more questions. 5 minutes. 5 minutes. Okay, we got 5 more minutes. Thank you very much. So if there's questions from the group here, is there any particular questions you like? We got a question back here. Yes. Oh, okay. Yes. Okay. Yes, go ahead. Oh, you're
It's
live.
on now?
Yes.
Okay, all right. So first of all, congratulations on your results. Photobiomodulation for the brain works, and it is definitely something that we should all pursue. Second, but I do have some questions regarding the depth of penetration. So first of all, hair. So how much does hair interfere with the absorption of light in the brain, considering that some people don't have hair, others have very thick, dark hair, others have, blonde hair. So have you ever measured any difference in between, considering different
That's
hair?
an absolute perfect question that everybody wants to know. You're going to have to stay tuned because we haven't done that measurement. That's next on our agenda to measure samples of hair to see how the penetration, how much it affects hair. Apparently, even wet hair helps for some reason the penetration. Is this out or okay? Yeah. Okay. Another question? Oh, one comment. Yes.
One comment. I mean, if our research has mostly been with men, I work at Boston VA Medical Center, but we do have some women who come in, and a woman came in and she had really thick, long hair, and she did not do so well. And my advice is, if you have a patient who's got this long, thick hair, and you can't find it really, but at least make a part down the middle, okay? And so you have a chance to get it in the, mid-sagittal suture line. And you'll at least deliver some photons, and the most important is right up here at the top of the forehead, mesial, prefrontal cortex, and that's where all the football players get bang, 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 bang. And that's why they came to us at age 55, 57, 64, and 74, because they played football American style 35, 55 years ago.
Yeah, that is fundamental. The fact that parting the hair and actually being able to go directly to the scalp makes a huge difference, because the scalp absorbs 80% of the energy that passes through, so just a small percentage actually reaches the brain, and also we don't know exactly how deep it goes into the brain. So that's why, can I ask you something regarding the...
Okay, I'll just mention one quick thing here. We did a study back 12, 13 years ago because of the cancer stuff with PDT. We needed to look at 635 nanometer. Now, 635 nanometer is very, very bad as far as the wavelength to penetrate. 660 is much better, 810 is better yet, and 1050 even a little bit better. So we went through 8 centimeters of pork breast tissue with the right amount of light power. Now, that's a different device, but regardless, it is possible to penetrate through breast tissue, which is high fat content, and also the skull is a high mineral content, which people don't think of, is easy to transmit light through. So just to take that into account, the bone actually acts almost like a light pipe too. So I've had people with treating one area. Yeah, so, okay. One last question, I think, here. Go ahead.
Thank you for your studies that you did on the knee. That was interesting. I'm wondering, did you do studies on fat? Because it does seem to be that a lot of people, who have different body shapes.
Just a little extra shape?
Visceral, adipose tissue, whatever you want.
But as a matter of fact, pork breast tissue is very, very high fat content. So I've looked at that, and pork is also very high fat content, but just straight fat of whatever kind. The other thing is, I would have loved to have blood flow through this thing, but it's very hard to get an animal on top of your device and get them to stay there. Okay, I think we have gone over time here. I want to say, so go to SunPowerLED, that QR code that we had, and you can, as Kelly and Jenny, thank you so much for joining us today and giving all the great work that you guys did. That was fantastic. All right, and so go to that QR code. We'll be handing later today, we'll also be handing out the studies for both West Virginia and also for the work that Dr. Naser has done. So, and please drop by our booth. Thank you.
Thank you.